So I think emotionally and psychologically, I have wanted this for so long, for 21 years. For me, I think this is I think this is like two surgeries, the breast augmentation surgery and the sex reassignment surgery. I've wanted both for so long that, when I finally came here and spoke to Dr. Chetwood, I was really excited. Like, I really wanted the procedures even more after speaking to the doctor. So, as far as preparing myself psychologically is concerned, I, shared my story on social media and I spoke to my friends and put videos up and stuff. And I think that has been sort of therapeutic for me to put all of this information out there and prepare myself. And everyone that I know, my friends and family and supportive people, they've helped me prepare myself a lot, because I know how difficult surgery can be. And even though I really want the surgery, the recovery process can be a little difficult. So I think preparing yourself is really important. And all of them sort of helped me be ready for this. And physically speaking as well, I think, I tried to gain some weight. I tried to make myself fit before surgery. And yeah, I think both mentally and physically, this is something that I've really wanted, and everything just fell into place. And it just went perfectly, I think. Yes. And a lot of other people say this as well. When you're talking to him, he gives you like a lot of attention. Yes. And the whole consultation, I had a lot of questions, and many of them were more medical. And he was answering all of them, and he had absolutely no issues talking to me about the procedure. And I asked him quite a bit. I think I spent a significant amount of time with the questions, and he was very patient. He sort of discussed all of the details. He used images and diagrams and pictures, and he sort of allowed me to hold the implants against my own chest and, actually feel them. And he essentially made me feel very comfortable, I think. And after the consultation, I was confident that, okay, he's going to do a great job. And the results were fantastic. So I'm very happy with everything, including the consultation. I think in a lot more detail than I expected. I was very, very happy with it. Yeah, definitely. And I think both Dr. Chetwood's instructions and the nurses helping out together, that made things very easy. And it was very simple. Everything just went very smoothly. So yeah, I was very happy with all of that. So recovery at the center was fantastic, I think, because there were so many nurses and so many people helping out. And the center itself is very well equipped, and it's very modern, and the recovery room, it had Netflix and everything. So I think recovering was easier there, and to have so many people like constantly checking up on you and reassuring you that you'll be okay, it went very well, and I was very happy with the recovery there. And the hotel was something that I was worried about, because the nurses would not be there all the time, and they would come only once a day. So I was worried that something might go wrong or something, but nothing like that really happened, and everything was fine. The nurses would come every morning and check up on me and just reassure me that everything is okay. And it was really nice, and especially this particular hotel, I think, just being outside in the open, and there's so much nature around you. It's nice to recover in that kind of a space, especially with other people going through the exact same thing. Yeah. So yeah, that was really nice, everything put together. I'm very happy with how, well structured and how, well put together the whole experience is. So yeah. I think the nursing care is one of the best I've ever seen, and when it comes to surgery and recovery, I think the doctor's work and the nurse's work is equally important, because when you're recovering, it's important to have that level of care, to know that everything is going to be okay, and to make sure that the doctor's work is not spoiled because of something that you may do. So I think the nursing care was very, very important for me particularly, because after the surgery is over, Dr. Chetwood is a busy man and it's difficult to meet him every day. That's not possible. So I think the nurses kind of really, really made me reassured that my results are going to be okay and my recovery is going to be okay, and that's exactly what happened.
Yeah.
Everything was fantastic.
Yeah.
I don't think so. I think everything was quite perfect. I think everything was great as far as my experience is concerned. So if anything has to be improved, I don't really see much, because everything was as good as it could possibly be anyway. And I think that's fantastic, and kudos to the center for that, because they've made sure that everything was so proper and in place that there's not much to improve, I think.
Okay, so thank you.
I've always known that my body was not quite right, and I always knew that I was not a boy, and it was difficult for me to go through that. And the discomfort that we have with our bodies can be very difficult to deal with on a day-to-day basis. So I think over the years, as that discomfort became more and more, it was very obvious to me that the only way to handle this is to have surgery. And I think after having the surgery, just looking at yourself in the mirror, I think that's an incredible moment. It's like fantastic, because you finally see your body and your mind be the exact, when you look in the mirror and you see your body and your mind match for the first time. I think that's an incredible experience. And to see that discomfort go away is so much easier now. Just to go about your day-to-day life, just put on your clothes and walk out. I don't feel that discomfort anymore.
You are very confident.
Yeah, I feel so much more happy with my body and myself. And I feel like I can be exactly who I want to be. And I think when you're happy, you are also better in your career. Because if you're not happy, you can't be good at what you do. So I think just being happy with myself makes me a better medical student and makes me a better person. And I think that will only help later on in my career as well. So I think when it comes to transition, there's no right or wrong answer with respect to how you go about it. Different people have different transitions, different people have different processes, and the kinds of medical procedures may also not be the same. Some people may want surgery, some people may not want surgery. So I think it's important to spend a lot of time just thinking about yourself and what is best for you. And it's very important not to rush into a decision, right? Like, it's important to take the time to really understand what is best for you. And it's also very important to do research, like look up as many surgeons as you can, talk to patients, talk to people about their results and their experiences, and just gain as much knowledge and information as you can from different sources. And once you've done that, it becomes much easier for you to make a decision for yourself. And once you do that, once you've decided that, okay, this is what is best for me, then I think the next step is deciding, how to go about surgery and how to finance it and so on and so forth. So that of course comes much later, but the first step is get your information, get all of your facts, get all of your research in place, and then based on all of that, make an informed decision, and then everything is easier. So with SRS, I was worried that I may not have sensation for a long time. But I think when the packing came off about a week after the surgery date and the nurses were cleaning me up, I could feel everything. Like, I had sensation, and I was very surprised because I thought, oh my god, I actually have sensation just 7 days after surgery. And every day, like, the sensation gets a little bit better and you start to get more and more. But I think with his technique, with Dr. Chetwood's technique, the sensation is fantastic. And that's one of the first things that you experience after surgery. That even though there is swelling, there is, a little bit of blood, There is a bit of bruising in the area, but the sensation is there.
Yeah.
Even when there is so much swelling. So I think that's very impressive. I was very impressed.